next panel discussion. We're talking about artificial intelligence is helping in building smart healthcare ecosystem. The discussion promises to be a true eye-opener. We'll be exploring the incredible ways in which artificial intelligence is revolutionizing the healthcare landscape. And I would like to invite on stage the panelists now, Dr. Geetha Manjunath, CEO and founder, NIRAMAI Health Analytix. And I'll request all of you to join me in welcoming the lady on the dais with a round of applause. Please keep that applause going for Mr. Ankit Maheshwari, CTO and President, Innovaccer, joining us as well. Dr. Rajiv Chhibber, Vice President, External Affairs of SMT, joining us in the conversation. Dr. Rajeev Sharma, Vice President, Medical Affairs, Tata 1mg, joining us for this panel discussion. There's a thing called karma. If you clap for the people coming up on the stage, there'll be people clapping for you when it's your turn to step up on the stage. So please make sure that you show our gratitude through a round of applause for everybody stepping up. Inviting the moderator, Ms. Nikita, Kochhar, Startup India, joining us on the panel to take this conversation forward.
Mic check. Good morning, ladies and gentlemen. We've had a few insightful sessions the past couple of hours, and we're privileged today to be joined by some of the brightest minds in the health tech space, also working at the intersection of artificial intelligence. This is one of the spaces that has taken the world by storm. We are hearing about it all the time. The incoming of ChatGPT, Bard, multiple competitors coming in. But specifically in the health tech space, it has the potential to disrupt the entire industry. And that's what we're going to hear today from our panelists. I don't want to take any more time away from our speakers. And I want to just start by throwing a question to the audience, and potentially we can take it from Ankit and we can move on. So I want to ask, how do you think artificial intelligence can actually help bridge the gap between healthcare supply and demand, especially where there are resource constraints, there are certain requirements in certain areas, and what do you think the innovative approaches have already been in the industry that have kind of disrupted the space?
No, I think that's a great question, and I will try to give an answer how I'm seeing, like, we work with the US healthcare primarily, and this particular thing, right, AI helping the shortage of clinical professional like nurses is widespread in the US right now, and how AI is helping. What we have already started seeing, the first piece is being the first response to the patient, right, when they call in for a lot of things, right. Can AI be the first line of defense where they're diagnosing their problems basically and then rerouting to the right, say, clinician basically, or trying to get them the right appointments so that you don't have a personal being over there. And how I see, like, or what we have been seeing, the first usage of AI right now is not specifically in the real world becoming on the clinical side, but how we can reduce or help them reduce the administrative burden that comes around the whole healthcare ecosystem over there. All the other work that they were doing, right, which is taking them away from the patient, can that be done through the use of AI? Clinical, still people are a little skeptical, which will be with healthcare industries has been the slowest always in adopting technology worldwide, not just in India over there. So I think it will take time to get there. Maybe I think the life sciences and the research will pick up much faster than before we see AI happening inside a doctor's clinic to diagnose you or to suggest you what you have. But yeah.
Sure, I think that's a very valid question, because that gets into the area of what's the cost benefit when using AI. So, in my opinion, there are four very categorical areas where the supply-demand mismatch is very adequately fulfilled by using AI. And Like the first one could be in terms of the Indian diaspora. When we talk of the doctor and patient ratio, it's very skewed. So effectively, when the patient is going to the doctor and spending time with the doctor over the consultation, he has a lot of questions that he comes back with no answers. It could be very simple, like, whether medicine should be taken before the food or after the food. And I think that first response, which Ankit also said, is very important, and AI can play a very important role. Second, very important part is where we're talking of mental health. And in mental health, the psychiatrist and the number of psychologists are very, very few as compared to the number of people who are suffering from this mental health burden and pandemic. There are roughly 15,000 psychiatrists in India, and half of them would be good enough. So we're talking of the first line of response and continuous engagement with them. Thirdly, in diagnostic space, and I have a diagnostic veteran with me here, but when it comes to radiological imaging as well as pathological diagnostics, AI plays a can play a very, very important role, especially in rural India, rural areas, where at least the first part of screening, which is definitely going to result into very less false negatives, can play a very, very important part when it comes to bridging the supply and demand in healthcare. Thanks.
Thank you, right? Yeah, so very nice to be here among all of you. I'm Geetha, founder CEO of NIRAMAI. So the way I sort of want to look at it in terms of what are the key outcomes we want to derive of using AI in healthcare, right? And what are those sort of the big cohort of applications we can have. So I agree with what both the panelists mentioned, but just to sort of put it in the broader context, I think there are three main buckets of applications we can have AI help for healthcare, right? So the first one is operational efficiency, and we talked about, the way we contact the person, how quickly we contact, how we efficiently utilize the resources in a hospital, for example, an ICU bed, how we reduce the patient waiting time at different places. So many of these operational efficiency, resource efficiency related applications form in one bucket, in my opinion. The second bucket is the clinical efficacy related applications, where the example of diagnostics being helped by an AI robotic kind of a system, where you're reducing missed diagnosis and misdiagnosis. That is, you're not over-diagnosing something as well as not missing any. For example, cancer and radiology is a great application. AI in radiology is really, really picking up quite a bit. And here we can look at multiple diseases and how AI can predict, depending on what stage the patient is, in a preventive wellness space, looking at continuous stream of data that is coming in and creating a kind of an alarm system either to the patient or the doctor, depend again whether there's a doctor looking at it, ensure that we have timely care. So here there is some kind of a clinical decision support system activities that are being picked up by AI. The third big bucket is, it is kind of operational efficiency, but more focused on the patient-centric affordability and accessibility bit of it. So I think if you look at the outcome of any application you want to do under three buckets, then several of the commonalities around it come forward. Just to sort of talk about our own experience in this, about building AI-based breast cancer detection, we've been able to sort of improve in all the three places, and more so, of course, in the second and third, because now we are able to do a completely automated breast screening system, right, for triaging in rural areas, with the simple health worker being able to say whether this lady requests to be brought to a hospital or not. So here it is high quality healthcare, making it affordable as well as accessible, because you're taking this not just in hospitals, but you could also take it, because it's portable, take it to rural areas and so on. And clinical decision support, this missed and misdiagnosis piece is very, very critical, because, for example, mammography is now known very widely to miss almost 20–30% of cancers because of what's called as density issue. And so here again, AI can come in and make sure that any suspicious lesions can be pointed out. There are several applications in each of these domains, and would love to sort of discuss with any of you who are interested in your own specific domain as well. Thank you.
Yeah, good afternoon, everyone. I think I agree with all the three panelists, and I come from, in fact, a very different background. It is medical devices, and medical devices, we are an amalgamation of what engineering and medical science can actually do. Technically, what everyone would be talking about is how salt discovery and how AI and your ultimate diagnosis could be impacted through that. What I am trying to look at and where we would want to actually use AI is how between the entire systems, you've got imaging as a medical device, you've got your disposables, consumables, implants. Everything connotes to a patient safety, everything connotes to something where there needs to be a process towards healthcare. Now, if we have all of these bits and parts through a smart system given not only to the doctor, not only to the the chemist, it will make us more efficient in terms of understanding how AI would actually transpire into the patient's journey. Everything, like what ma'am said, everything what requires is transpiring to a patient's journey. Today, if there is an ambulance, the ambulance needs to have the entire set of gadgets which can actually send a signal down to the doctor or that particular specific hospital, so that the hospital is already alarmed, they have the bed ready. If the patient requires a cardiac implant, the cath lab is ready. Post that, whatever diagnosis is required, it is already available. It should not be that by the time the 40-minute journey, for instance, in a cardiac arrest, that golden hour that we call, the 40-minute journey is just a waste that once you reach, it's again the recalibration of the entire diagnosis that we're trying to do. So I think when we talk of medical devices, we talk of smart medical device healthcare, which also triggers a smart sense towards the patient safety. That's where medical devices need to really move towards. And it's only, so we have like under medical devices 7 categories as of now: consumables, disposables, implants. The biggest thing that has actually come up has been electronic medical devices. All your gadgets, your watches that you're wearing, your phones that you're keeping, that triggers the entire journey, that triggers how the entire medicine approach needs to be looked into. So when we talk of AI, we need to be cognizant of the fact that AI is an amalgamation of whatever triggers and whatever comes to a patient safety. So I'll stop here because you have a couple of other questions, but then the premise always needs to harp on the efficacy, the patient safety, and what ma'am said, affordability, availability, and accessibility.
If I can add one point here, he brought up a very good point about medical devices and 7 categories. Because we are talking about AI, there is a new category of medical devices that has been started. It's called SAMD, right? Many of you may be aware, which is software as a medical device, which is the AI algorithm itself becomes a medical device. And for example, in our case, we could get FDA approval and CE approval for the AI software alone, irrespective of the hardware. So it's an excellent move forward, showing how AI itself is coming into the healthcare.
Thank you so much to all the panelists. I think you've covered the entire ambit from diagnostics, medical devices, how it will facilitate even administrative processes, and that may be the start of this AI wave that we have coming up. I do want to, just pick up from there. We've seen how the gap may be bridged, but Dr. Rajeev, maybe you could tell us a little bit about how 1MG or maybe, a healthcare platform specifically would leverage, the rapidly growing technologies and see what the future predictions could look like. And I know you touched upon this a little bit, but would love to hear more.
Sure. So let me start with, maybe what future looks like, and then AI, and then what we're doing at Tata 1MG, right? So from a digital healthcare ecosystem of how we see in the next 10 years, we look at it, in a 3x3 kind of a metrics, and it's all going to be around data. That's point number 1. And the framework will be data collection, storage, and utilization. Now, this will be for the doctor, patient, and administration work, like everybody said. Now, with that framework, just keep that in mind. And if I have to look at data collection, we are talking of Internet of Things, right? We're talking of Internet of medical devices. We're talking of all kind of smartwatches, wearables. We're talking of all kind of data collection from electronic medical record, every instance that happens between a doctor and a patient. We are talking of even diagnostic reports that give us data. Now, all of this data needs to come together, get stored in the form of, in a cloud or locally, and then it needs to talk to each other. So you need to have interoperability. That becomes the data storage, and that's where it becomes very important that cybersecurity, be it blockchain-based or be it regular security, that needs to be very amped up, and that's one area where we see high level of action. And once that is done, that's when the utilization happens. And utilization happens with the consent of the person or patient who owns the data and the custodian of the data. And that's where you start using artificial intelligence, data analytics. That's when you start personalized medicine, preventive and predictive healthcare, chatbots, assistants, healthcare assistants, as well as, going forward, it could be AR and VR. Now, specifically AI, how we are looking at Tata 1mg, there is a very interesting problem that we are trying to solve, and it's something, and it's a very tough problem for profiling of patients. So when it comes to profiling, when a patient goes to a doctor or he shares his information with another colleague or family, he has a hoard of data that exists with him either in a file or multiple EMRs now, as you would have seen in US. Can we give him one snapshot of what his health looks like today? And that's a very, very tough problem, because you need to extract information from all the electronic medical records, could be diagnostic reports or whatever, and give him one snapshot so that he can go to the doctor. Doctor takes the minimum time to see what could be the next step. So that's one problem. Secondly, we are also working on customer experience. So, we are a B2C, digital platform. So the number of people who touch on Tata 1mg are, a couple of hundred of millions every year. So what we're doing is we are ensuring that the experience and the connect with the user is as much as possible. At the same time, it is as rich as possible, and AI makes it super easy. Thirdly, we are also working on, which is our core content and information dissemination. So we work on making health very understandable and easy for the users. And with the chat GPTs and bards of the world coming in, it definitely makes the productivity of our content writers much richer, much stronger, to make healthcare easy, not just in the language that is very popular with the health tech ecosystem, but also vernacular. And that's where the whole AI helps us very, very much, because we can reach to the heartland of India, the Bharat, and also dissipate information in their own language in a way they understand. And that's where we see AI being worked for us in the very near future. Of course, when I spoke of the first one where we are giving the profile, it's very easy to extrapolate, and that's what the future in the midterm looks like, where electronic medical records, if there are 50 times a patient has gone to a doctor and he has his consultation records, doctor will not click on all the records and look at every record. That's very difficult. Actually, that's more tough than the hoard of file that he can flip through quickly, to be honest. So I think the AI will be very, very helpful in extracting information, and just giving him one summary that this person was a known case of diabetes, suffering from thyroid, and comes with a bleeding great toe and has a chance of developing a foot ulcer, right? So I think that's where we are seeing us making use of AI, as well as AI progressing.
Thank you so much. I think you really touched upon some key pointers with the interoperability and EMRs being very relevant also moving forward. Given data privacy and all of that, we do see that there is a long road ahead in terms of research, in terms of the kind of development that's actually going to come up with AI. And Dr. Geetha, we want to hear from you. What do you see are going to be the trends in the R&D coming into artificial intelligence for the health tech sector, and how is that also impacting your work at NIRAMAI through your breast cancer solution?
Sure. Starting with the second part of the question, right? So today we use AI for clinical decision support at NIRAMAI for detecting breast cancer, as I briefly mentioned before. So we decided to take a modality which is not very commonly used in the world for breast screening, but has been tried in research before. This is a thermal scan, basically. We just measure the temperature variations on the chest using a thermal sensor, which is a high-resolution thermal sensor. We have about 4 lakh temperature points per person. So now the AI comes in to interpret or understand different patterns which may signify abnormality in the breast, right? So that's where the AI comes in, because visual analysis of this is known to be very subjective, erroneous, because it's thousands and actually lakhs of points of data that is being thrown in front of the doctor. All said and done, he or she is still a human, so we do have limitations. And also, when you visualize it, we show it in color. So a 34 degrees Celsius and 35 degrees Celsius both will appear red. So it's very difficult to differentiate minute variations in temperature with bare eyes. So that's where the computer-aided analysis and the AI part comes in. And we've been able to show very high levels of accuracy, sensitivity, and specificity when compared to both mammography, ultrasound, biopsy results as well. Now, where do I see AI changing? And this particular use case, for example, can be expanded beyond breast cancer, right? You could basically use this for other type of cancers, and we've started seeing that it need not be cancer. Any of the vascular abnormalities, inflammatory, diseases, and even pain management can be, potentially analyzed, and automatically you can identify the source of pain, source of the potential pre-cancer aspect, because the first signal it gives out is cell division, and that cell division at an abnormal rate can be picked up very with final analysis. We can pick it up from thermal and vascular analysis, which we do. So this is very exciting for me. So just like Dr. Rajiv was mentioning, we do have a concept of whole body scan that we're working on, where a person enters, and it's almost like an ATM machine, and you take a snap, and then with AI we figure out what are the likely abnormalities in which part of the body, and then we could basically send them to a full-fledged diagnostic workup with an MRI or something later, because everyone cannot go through a radiation-based test, and it's not also affordable. So in broader term, just to take 1 minute on it, and we've heard a lot about ChatGPT, generative AI, and all of that. And the way I think about it as a computer scientist in me, irrespective of the healthcare, is that how artificial intelligence algorithms and applications have evolved from simple, automation of dumb tasks, of repetitive tasks, to now clinical decision support. And now third step of Gen AI is creative tasks. It can actually generate data which does not exist in the training. It can actually synthesize new kind of applications. And when I picked it up for healthcare, there are 2 main applications which stand out in my opinion. One is what was talked about, the user interaction, chatting with the end user, answering very simple questions and so on, and making this interaction very humane in nature, right? And the second big one I'm excited about is in medical education, which is more in the imaging domain. You would have gone to hospitals, and you would have if you find a patient with some rare disease, you'd have 10 to 20 students walking in, just to, do the, talk to the patient, see all the reports, because it's very rare. And how do they actually get hold of such cases? Now, with generative AI, DALI and ChatGPT kind of systems, we can simulate cases which may potentially exist. Can I see an image of a person who has breast cancer and lung cancer? Just making it up here, right? But comorbidities are very common. And instead of looking for a patient who has that comorbidity and studying, can we generate that? I think that's a huge potential which currently nobody is looking at. If you want to spend your cycles, again, happy to sort of work with you. It's just, I feel it's such a big area that can benefit so many students and so on. Yeah, I can go on, but I'm seeing that there's not much time.
Thank you so much, Dr. Geetha. Talking about kind of synergizing all the information and how R&D is kind of going to do that moving forward, I want to come to you, Ankit, in terms of the collaboration, and what artificial intelligence is going to do to the co-pilot model between healthcare providers and patients, and how you see that moving forward.
No, sure, I think, and a lot of things like even what Rajiv was talking about, the possibility of how things will happen in India is that today in the US healthcare system, day in, day out, right? We are interacting with, say, 30 plus EMR system, all the labs and pharmacy, getting all that data together into a single place, running analytics on top of it and giving those insights to the provider at the point of care. And we have been doing that because just normal data analytics and machine learning right over there and giving those insights, right? Sifting through all their journey of data. How now AI or generative AI in particular basically helps specifically the co-pilot model. So like we have a product right now which sits in front of a provider whenever a patient comes in. They don't have to go through basically their whole history, and it tells them, okay, these are the 5 most important talking points for you. That this person who has an HbA1c of greater than 9 has not got it tested for the last 9 months. That is something that you need to talk about. They have not got their annual wellness visit done. That is something that you need to talk about. And also, like one big thing that once India also gets into that stage of documenting everything, that's a big task for a provider or a nurse or somebody or a scribe sitting over there. Because once you are in a patient visit, you need to document and put that into an EMR. That's a task, right? That takes, at an average for a doctor in US, out of their 8 hours of work shift, almost 1.5 to 2 hours, right? Gone, where they're not seeing the patient, but just entering data into the system because it needs to be entered in a particular manner for the interoperability to work, right? It's not easy that you cannot just enter in paragraphs and everything will work seamlessly for the interoperability to happen when there are different systems interacting, right? So how can you automate that piece using the co-pilot? Where imagine there is a device just sitting or just your computer over there who is listening onto that conversation, from that conversation generating, okay, this was the problem, this was the diagnosis, these are the tasks that it's identifying, and then in that particular format, enters it into the EMR automatically. The doctor just verifies, approves, and it goes through, right? So, and saves that time, basically, and so that is what we are seeing. We are right now in process of implementing it across multiple providers in the US, and that is one of the biggest pain points, I will say, which they feel, because this is something which no provider wants to do. They want to be sitting with the patient, want to interacting with the patient rather than spending time on the computer, right, entering the data. But that data is very, very important if you want to do all the things that the panel was talking about, if you want to have that early diagnosis or basically multiple chronic conditions and you want to give those suggestions, you need that data, right? But how you can do those things, so there is where we see as a co-pilot working. The clinical piece will also come in, right, where you can help them in secondary diagnosis, right? That because now you have this vast information of data that goes in, and if you can reduce the hallucination, what we have been seeing, and we have been working with Microsoft and other partners on OpenAI, that how we can reduce the hallucination of AI so that it's much more pinpointed when it's doing the secondary diagnosis and helping providers, okay, because you said these things, and because of the history, these might also be the diagnosis over there. But the clinical acceptance is still a little fizzy in the healthcare world, especially in the US right now. All the US hospitals have banned ChatGPT in their clinic, but slowly and slowly that will come in once more proficiency gets in. So we are right now focused on getting this administrative workload done and then slowly moving on to the clinical piece.
Thank you so much, Ankit, for that. Dr. Rajiv, I do want to come to you and talk to you a little bit about the medical devices space and how you see AI is kind of being realigned into the medical device space. We do have a certain level of dependence at this point, but are kind of looking at innovation to be more self-reliant. So how are you realigning that journey as well?
Yeah, so as you rightly said, medical devices are almost like 75% import dependent here in India, but then it's the case for high-end medical devices. What the medical device industry has actually done over the past couple of years is use this opportunity to convert ML. Large manufacturing that we have started to do is all now based on AI too. And AI ML is now helping us not only in correct manufacturing, R&D perspectives, but also catering to even the remotest part of the country. So if you look at it through Ayushman Bharat, what we're trying to work around with the National Digital Health Mission also, as well as simultaneously with the NHA, the National Health Authority, is to provide essentials to the last mile delivery. And that can happen only when there is a trigger. It happens immediately, manufacturing ramps up, immediately your supply chain, the SCM, the supply chain management actually moves into it. Your diagnosis which comes back from the hospital helps us to also convert the same data analysis to enrich our R&D, the research and development that is required to create. For instance, if you look at stents only, I come from the cardiovascular industry, so giving an example there. The amount of modifications required in a particular device or a stent that is going to help more efficient cardiology maneuverability into the patient itself will come only when that data is given to us, deciphered, and then converted into a new device itself. Similarly, if you look at the entire ecosystem approach, it triggers the entire self-reliance that we're talking about right now. We spruce up not only the part where we look at investing into certain areas, but also where we were not doing right. So here we're catching up with the electronic device industry. They are providing us with the much needed data. They are providing us with not only the required data which the patient looks into, but also helping us to source the entire learning towards converting it into something which will be more efficient to the patient itself. Look at how Tata 1mg helps us, or Medica Bazaar, or in that sense, a couple of other would end up helping us. They would actually relay it back in such a way that we move into the entire enhancing that data part and converting it into not only hospital management but also patient safety. So that's a big divide that we're trying to rope into. Medical devices is in India, it's in the nascent stage. In fact, if you look at it, very less high-end medical devices are there. But whatever are there, we are actually trying to look at how demographic profiling can actually help in not only policy making, but also in manufacturing and also sprucing up patient safety.
Thank you so much for sharing that, Dr. Rajiv. I see we have the paucity of time coming toward us, but I do want to open the floor finally for any closing remarks that you may have. We've spoken extensively on the AI space, and we do want to close this conversation as well. Dr. Geetha, if you'd like to start.
Sure. I think I just want to say it's an exciting era where AI is touching a domain which is the last touched, I'd say. Healthcare is always the last in the line when it is related to adopting IT or adopting anything. So it's very exciting. There's a lot more opportunities and waiting for all of us to solve. And at the end of the day, you're touching lives, and it's so fulfilling when it really happens.
Dr. Rajiv.
I would say AI has a huge potential, but it comes with its own perils, and healthcare is a little different. We cannot work with Pareto rule here. it has to be 100% right most of the times. So like ma'am had said before, false positives and false negatives both are going to be tough, and how we start using AI step by step, be it for screening and then moving on to interaction and then maybe clinical decision support making systems, and ensuring that the patient's safety is always at the center of using technology. I think it's very important for us to ensure that ethical and regulatory frameworks come out nicely, which I'm very happy that even EU and Indian government is already kind of in the drafting stage. So interesting times ahead, safely and steadily.
Thank you.
I think very rightly put by Rajiv, right? Like with AI and like this whole journey, specifically in healthcare, right? I see it in three different ways. Like first, like I said, the administrative piece. Second is the clinical piece. And the third, I think, which will really get changed is the research piece, right? When we talk about the life sciences organization, right? Over there, I think across these three verticals, there will be a gradual acceptance. I think the workload, reducing the fatigue will be the first and the easiest way where we can help the healthcare industry. The second will be, okay, secondary diagnosis, clinical, and in parallel, if the research can be impacted, right, how quickly can we have the solutions for disease, right, over there, be it from an imaging, be it like working on newer vaccines, basically, can a COVID vaccine would have been generated more quickly if generative AI would have been there. Those possibilities, I think, will really revolutionize healthcare whole paradigm, right, and touch all the stakeholders and not just one. And then, obviously, the center of all of this is the patient, and that is why while we are working, and it's not just for the AI, for any technology that we work with, keeping the patient at the center and understanding that we are building something which is useful and not just cool has to be a bottom line for technology and AI in general.
Thank you so much.
Yeah, so I'll just sum it up saying that digitalization and AI is important, and as we move towards 2030 and we also move towards 2047, we need to still remember the basis that anything in this field needs to be human-centric, needs to actually be science-based and data-driven.
Thank you so much. I think this is definitely an ongoing conversation we're going to have for years to come, but it was great to have all of your insights. Thank you for being on this panel.
Can I request you all to take a picture together, please? Thank you. Thank you, Ms. Kochhar, for moderating the session. Dr. Manjunath, Mr. Maheshwari, Dr. Chhibber, Dr. Sharma, thank you so much for joining in and sharing your insights.